County Executive Mark Polenkars with another COVID-19 outbreak update from the Rath Building. It is Monday, April 27th. It's been approximately, I think, 45 days since we started our first press conferences like this. And at that point, we had 0 cases, 0 deaths, and as you'll see, we've grown, and so has New York State. But I am pleased to be joined here by our Health Commissioner, Dr. Gail Burstein. We'll be talking a little bit about the issues associated with, of course, the COVID-19 outbreak. I'll be talking about some business aspects of it today. And we're also joined by Kendra from Deaf Access Services, who will be providing us the American Sign Language. As always, some provisos at the beginning, just to note that the information that you see in the slide presentation is as valid as it was at the time that it was created, which was basically confirmed about a half hour ago. And as always, it sometimes changes. So now we want to once again remind everybody that we have changed the testing criteria at the Public Health Lab, and I'll turn it over to Dr. Burstein to talk a little bit more about that.
Thank you. Thanks, Mark. So just want to remind everybody that we've completely expanded our testing criteria to include anybody who is symptomatic. And so we know that the symptoms of COVID-19 are pretty vast, so if you suspect that you may have symptoms related to COVID-19, we would like you to call our appointment line at 858-2929, and we are swabbing people 3 times a week, Monday, Wednesdays, and Fridays, and they're by appointment only, so please call us. And when you call that number, 858-2929, you'll be provided with a menu of different options. So option 1 is for people who just have general questions about COVID-19. Option 2 is for people who are ill with COVID-19 related symptoms and they have a primary care provider. Option 3 are for people who are ill with COVID-19 symptoms and they do not have a primary care provider. And option 4 is for healthcare providers to call us with questions. So remember, if you are tested for COVID-19 by any laboratory, our lab, any of the hospital labs, Quest, at any of the urgent care centers, when you have that specimen collected, you are in isolation. At the time of specimen collection, you should have either access by the web link to our isolation orders, or you will have received it beforehand, either by a web link or in paper. So remember, you are in isolation when that specimen is collected. That starts at that time. And then you can be released from isolation. We give you information about how you can release yourself, either when you receive a negative test result, or if your test result is positive, we will provide instructions when people can be released from isolation. Remember, you are in isolation. However, there are opportunities for people to get paid leave while they are in isolation for COVID-19. There are options from the New York State and the U.S. Department of Labor. So please look at those websites if you are in isolation for COVID-19 for any reason, and look at what your options are, because you should not have to suffer because you are out for sick leave.
Thank you, Doctor. The latest update on cases, as of 2 p.m. today, there were 3,061 positive cases across all Erie County. 207 people had perished, and we do offer our deepest condolences and sympathies to the family and friends of those who passed. This is the same number as we had yesterday. We often get a delay from the deaths that occur on the weekend, especially from the Sundays, and we should have an updated report on that later today. These are, of course, all lab confirmed cases. There are no presumed positive cases. Each individual had tested positive before their death for COVID-19. Hospital report, people like to see this, and we think it's an important thing to determine where we are on the curve and on the trend. We had been seeing the hospitalization numbers go down. We had been seeing discharges exceeding admissions, but we've had a little blip. As of April 25th, there are now 225 people who were hospitalized. Of those, 112 were in ICU, and 81 of those had an airway assist or intubation. And as you look at this chart, you will see, oops, we jumped over there. Something's wrong. We seem to have a problem. That's not the right chart. Skip that. Go to the next one. There we go. I don't know how that got in there. But this is the hospitalization data, which is more important than any of the age and gender data, which I think we'll go back to in just a second. I don't know how that got on there. But what you see is the blue line, which is total hospitalizations. There was an increase from the day before. ICUs, there was an increase, and there's been just over the last couple of days a very slight increase with regards to the intubations. But we saw basically 12 new people enter ICU from the 24th, which had about 100 people in ICU, to 112, and we've seen a little uptick with regards to the overall cases as well. Deaths, there was a big jump on the 12th or 23rd, excuse me, in which there were 12 individuals who perished in hospital. Since then, we have seen a reduction in the number of deaths, but we do see these increases in hospitalization. Not big, but we did have a nice pattern there for a few days, a trend of going downwards, and now we're seeing this uptick. To give you a little different idea, here it is over a 2-week period. So if we go to the next slide there, Derek, yes, that's right. The governor has talked about wanting to look at 2-week trends. We know we are in New York pause order still through May 15th. That is not changing. But then effective May 15th, there's possibilities for regions to be slowly reopened, not a complete reopening, based on primarily hospitalization data and death data. And as you've seen, this is the last 2 weeks. So it's been fairly constant with regards to hospitalizations. We had the highest date ever back on April 18th or 19th, excuse me. And we have the slight declination since then, a little growth this last few days. So we'll be constantly monitoring this 2-week pattern to see if there is an increase or decrease. We really want to see a decrease over a 2-week pattern. We don't want to see an increase over a 2-week trend period. If there is an increase in a 2-week trend period, that's not a good sign with regards to where we are on the curve. We believe we're somewhere on a flattened portion, but are we at the beginning of it, the middle of it? Not certain just yet. So we'll be keeping a close eye on this. Dr. Burstein, did you want to add anything else on the hospitalization data?
Yeah, so we are, seeing, as our county executive pointed out, a trend that it looks like we are flattening. Even though we have had a little bit of uptick in the past couple days, we'll have to see if that trend persists. But remember, everything that you do today will be reflected on that graph in 1 to 2 weeks. So please remember, we have to continue with our social distancing.
Then the next chart, of course, shows the hospitalization admissions versus discharges. And we talk about admissions, we're talking about those that are admitted who were already confirmed COVID-19 or those who were determined in the hospital to be COVID-19 positive versus those that were discharged at any one day. We had a nice little trend line there of 4 days in a row in which discharges exceeded admissions, but on the 25th, admissions slightly exceeded discharges, so that's always something that we're keeping track of. We want to see is in total that the discharges are greater than the admissions. As you can see in the days beforehand, we had a period in which admissions exceeded discharges. So we'll be keeping track of this. This data is being shared with New York State, so they're aware of it. And as we get closer to May 15th, we're hoping that we continue to see discharges exceed admissions, as well as the total number of cases drop. Mortality data. This is a breakdown by age and gender, and as you can see, for the individuals who've perished as a result of COVID-19, out of the 207, 109 of them are men, 98 are women, and once again, it is approximately 75% of all individuals who died from COVID-19 who are over the age of 70, but that does not mean that someone as younger cannot succumb from this. We have had 4 individuals in the 30 to 39 age group who've died, unfortunately, of COVID-19. 5 individuals in the 40 to 49. Just as we've said all along, and right from the beginning, even before we had 1 case or 1 death, the evidence from China and Italy showed that the older you are, the more at risk you are to unfortunately perishing from COVID-19, and the statistics that we see in Erie County confirm that as well. The next chart just shows you basically those same numbers, but in a bar graph, and it's pretty visual that the individuals who are most affected by this are over the age of 70 primarily, but even the 60 to 69 category. Mortality data by race and ethnicity. This has pretty much stayed the same over the last few days. Black or African American at one point was 33% of overall deaths. It's probably dropped down to a little less than 22%. White fatalities have been creeping back upwards as a result of that. Hispanic or Latino is very low compared to the amount of Hispanic and Latinos. It's 1.4% right now, even though the Hispanic community makes up more than 5%, as you will see in the next slide, which breaks down and does an examination of the percentage of population that we know of versus the percentage of fatalities. And you can see there's a slight less amount of whites, more by approximately 7-8% African Americans, and then of course with Latinos, basically it's 1/3 of what they generally make up of their population. So we keep watching this. People wonder why we look at mortality data with regards to race and ethnicity, because we know of areas in our community where there's a high preponderance of African Americans living. So we check that out for additional potential outbreaks. We also look at issues with regards to comorbidity. Are there other factors that may come in that we want to know? And so these are important data points with regards to determining where an outbreak may be at any time, in addition to where the most recent cases are coming from. Comparison. We have comparison, of course, that we've shown for the last few weeks on and off with regards to Allegheny County, Pennsylvania, where Pittsburgh is, and Cuyahoga County, Ohio, where Cleveland is. We still have more cases, and based on as well as we have a gross number of cases that are higher, and then our per capita based on our population, of course, is higher. So we're still concerned about this with regards to the number of cases that we've had here compared to what would be considered our peer group in this region of Cleveland and Pittsburgh. So we continue to watch that because it is of concerning to us, deep concern that why are we doing a little worse than what our peer group in the region are. We can't really compare ourselves to New York City and our friends on Long Island, but we can do a better comparison with regards to our peer group, and right now we are still not doing as well as they are. The COVID-19 map, certainly we update this a couple times a day. It was updated just recently to show the 3,061 new cases, or total cases, not new cases, out of 13,917 tested. Our testing capability is really ramped up as a community. We have more tests now that we've performed on our residents than what was been done in Monroe County and many other counties across New York State. Dr. Burstein, would you like to talk about who's basically doing testing now for COVID-19 in our community, which is one of the reasons why we've had a lot more people tested?
Sure. So actually there are many opportunities for people to get tested with a polymerase chain reaction test. So that's a DNA test that will tell if people have an active infection with COVID-19. So we know that the Erie County Health Department is testing, as well as our hospitals, Kaleida Health and Catholic Health are offering testing to their staff and to the community and the patients that they serve. We know that the other hospitals, such as Roswell and ECMC, are also offering testing for their patients and staff. And then we know that the urgent care centers are also offering this type of testing, and then also some primary care providers are offering this testing. Kaleida is offering a testing at an East Side clinic. Located in an area that is hopefully accessible for people on the east side, and they are open on Monday, Wednesdays, and Fridays, and that is also by appointment only. So we know that there is a lot of testing going on, and so if people are interested, they can talk to their primary care provider and get a recommendation of where they can go get tested. They can also call our Erie County line at 858-2929, and we can help you either get tested by us, or if you have a primary care provider, get tested by Kaleida. And again, we know the urgent care centers are also offering testing. I can't tell you what the cost is for that, but you can call and find out. So there is testing available in Erie County, plenty of testing.
Thank you, Doctor. As the doctor noted, you can call our Erie County COVID-19 hotline at 716-858-2929 if you are symptomatic, if you have the symptoms of COVID-19. And there's two little buttons to push. Number 2, if you have a doctor. Number 3, if you don't have a doctor. you will be put in touch with an individual who can help schedule an appointment for you. This is for individuals who are symptomatic, in other words, have the symptoms of COVID-19. Now, Erie County responds. We've been doing tremendous response in many different ways, and one of the ways that we're doing it too is addressing the tremendous needs that exist with regards to our business community and the impact that we have seen with regards to the economy. We know that our community has been hurt just like many others, with a tremendous increase in unemployed, as well as decrease in just a number of businesses that can produce their product and sell them across the country. That's why I created the Erie County COVID-19 Business Task Force, impaneled individuals from across this region, co-chaired by Brenda McDuffie, the head of the Urban League, as well as the chair of the Erie County Industrial Development Agency, and Scott Pilata from Zender Ritlin, a company that is based here right in Buffalo, to come up with ways to create a stronger economy for all, to address the need that exists during this crisis, as well as to help our companies come out of this when we finally do reopen. We've already talked about a number of these things. The Western New York Business Impact Survey was put out by the Buffalo-Niagara Partnership. The date of completion of that was through last Friday. They will have the results on May 6th. We'll provide those results when we get them. The ECIDA and the Regional Development Corporation, of which I'm a part of, has a small business disaster relief program that's been created. This is in addition to the federal program. So we do offer small business disaster relief loans to our area companies, and this is actually not new. This was implemented back in 2014 in response to the superstorm that hit in November. The ECIDA is also working with our existing loan clients to provide relief during the current economic crisis, and we are offering assistance to our tax incentivized clients to ensure that they will not be negatively impacted just because they can't meet their workforce requirements at this time. But we have a number of new things to talk about, including, first of all, because of the impact that we've seen in the agricultural community, the Erie County Business Task Force, working with the Office of Agriculture in the Erie County Department of Environment and Planning, has come up with a new program called Erie Grown, with a neat little logo there. As you may know, a good portion of Erie County is agriculture in nature, including that area that's yellow at the bottom of the little logo of Erie County. That's all agricultural. In some ways, that's the breadbasket of Erie County, as well as our eastern suburbs, which have a high number of dairy and chicken farms. So we want people to understand that a good important aspect of our economy is our agricultural community, and they have been tremendously hurt. So we are creating a program called Erie Grown, which will help our local growers sell their product and also get into your hands the products that you want. As is shown from the slide here, in the USDA Census of Agriculture, approximately $131 million in direct economic impact comes from our agricultural community, and you can see the breakdown there. But there are 940 farms in Erie County, of which 96% of them are family farms. They're not big corporations, those big conglomerates that you often hear of that own the farms in the Midwest. Ours are family farms, and 21% of them sell directly to consumers. And we have 10% fewer farms than we did in 2012, and 22% of Erie County's acreage is actually farmland. So we need to help our farmers, and we also need to get goods into the hands of folks. So that's what we're doing to address what has really been, unfortunately, a big problem for our farmers, which is the commodity prices, the low demand for milk, disruption of supply and demand chains, the loss of institutional food service customers. That's a big one. We don't often think about it, but many of our farmers supply directly to institutional food sources. And of course, the loss of restaurant business. Greenhouses have been impacted. There's certain problems and backlogs with processing and packing facilities. We know that there are farmers here that actually deal with beef cattle, and they're having a problem because there are meat packers are shutting down. So there's a whole bunch of things that are being affected, and we need to help them by buying local. And that's why the Erie County Business Task Force has the Erie Grown Initiative. It is a project of the Erie County Office of Agriculture in partnership with the task force. The objectives are to buy local, promote the purchase of local and regional farm products by linking consumers with available local food products. It can be a resource hub for both consumers and growers, and will support farmers as they navigate the COVID-19 pandemic. Now, one of the advantages of the Erie Grown program is we have a farm locator map, which we'll show you in just a second how to get to, which is a map of open farms, farm stands, and farmers markets. as well as available community-supported agricultural organizations. Users can find the farm that's closest to them and see what is available, and these locations have all been confirmed as being COVID-19 compliant. So you can be assured that they're following proper guidelines with regards to safety and security. We also have a fresh produce finder. Yes, it's April in Buffalo, but many of these farms have greenhouses and they're growing produce right now that you can purchase. So you can search by the type of produce to see what may be available from a local farmer, as well as other agricultural goods. And I would be a bad county executive if I didn't also give a plug for our brand new batch of maple syrup that comes straight from our maple forest down in Sardinia, as well as Concord, and we just finished a whole bunch of that. We couldn't have the maple syrup days because of COVID-19, but the fresh maple syrup is available for you to purchase through our Parks Department. Just an example of some of the things that we have. So it's pretty easy. If you want to find out about Erie Grown, you go to erie.gov/Erie Grown, ERIEGROWN. The website is already live. I checked it out about a half hour ago. Farms and agribusinesses can enroll by visiting the website that you see on the screen. If you go to that website, you'll see a little map like that with those yellow dots, which indicates where the nearest farmer or fresh farm stand is near you. And for questions or information, please contact our Erie County Office of Agriculture in the Department of Environment and Planning, and you can send an email to agriculture@erie.gov. It's a great new program that we have. We want to support our family farmers locally. We want them to understand that they are an important part of our economy. We thank them. They are essential workers. They are out there providing the food on your table, the milk that you drink, the eggs that you may be using in the morning, or for that matter, if you like an omelet in the evening. We want to thank our Erie County farmers for the great work that they do. They are essential workers, and they're hurting just like a lot of other people. We don't want to lose our family farms, so please support them through the Business Task Force Erie Grown measure. We have also a number of other things that we're implementing. These are new. The ECIDA Emergency Loan and Sales Tax Program. We talked already about a disaster loan program, but this is even a different one. This program targets businesses that have been impacted by COVID-19 shutdown, which we know are a lot of people, a lot of businesses. It's businesses that need working capital and are investing in production or increasing distribution and supplies in response to the COVID-19 world that we're in, including those that are converting to a PPE production or increasing pre-PPE production, expanding distribution or increasing your supplies, or if you need to purchase of equipment or in need of working capital to allow for purchasing of equipment. So there's a whole bunch of information on the screen. I'm not going to talk too much about it, but we have gap financing loan programs to assist companies with a 12-month interest-only payment period through the Regional Development Corporation at the ECIDA. We're also offering sales tax abatement up to $100,000 for purchase of non-production equipment. We generally don't do smaller ECIDA sales tax abatement because we generally are doing larger projects that create jobs. But in this situation we realize that a business might need to get a sales tax abatement for up to $100,000 to purchase equipment. Basically the value of the equipment would be $1.1 million that they need to expand and to create jobs as well as to sustain themselves during this time. If you have questions, please call the ECIDA at 856-6525, or you can always visit it at ecidany.com for more information on this two important programs. The Buffalo-Niagara Partnership also has a COVID-19 business link, which is pretty simple. When you go to the partnership's website, thepartnership.org/businesslink. It's an informational and online platform for businesses that are impacted by the COVID-19 pandemic. It's a repository of curated information for local businesses. I like that line. It's an online forum for businesses to ask questions, not answered through existing resources, and members of individuals from the Buffalo-Niagara Partnership will get back to you. So I thank Dottie Gallagher, the head of the Buffalo-Niagara Partnership, and her staff for the work that they're doing to assist businesses in our local community at this very difficult time through the Business Task Force, as well as the work that they're doing. And then finally, SBA loan programs. I think it's finally, if I remember correctly. The SBA loan program, of course, the Paycheck Protection Program put an additional $310 billion in funding on the previous $349 billion that was in place from the CARES Act. That is supposed to have started enrollment today, so if you were shut out from the previous CARE Act funding because they ran out of cash, there is funding that's available. They've done carve-outs for small banks, so smaller banks and financial institutions, including credit unions, are eligible for that today. So we want those who are eligible to take advantage of these programs. They've also put an additional $50 billion into the Small Business Association's disaster loan program. And they also have an emergency injury disaster loan program. One of the things I wanted to impress upon local businesses who are having trouble getting in touch with the SBA, we have a Small Business Administration office in Buffalo. So you can contact the representatives of the Small Business Administration in Buffalo at 716-551-4301. Once again, that's 551-4301. So if you have a question in regards to your business, it's best to call the folks who are the experts in the business, including the Small Business Association, or administration, excuse me. And I know Frank Shorentino, who's the head of the local office, and his staff are going to do a great job to ensure that small businesses are helped as best as we can. And we recommend that you call them if you have a particular question with regards to these loan programs, whether it's difficulty applying or just what your company may qualify for. With that, I want to thank everyone once again for the good work that you're doing to prevent the further spread of COVID-19 in our community. We know we have done a good job of reducing spread. We are seeing a stabilization in our hospitalization numbers. As the doctor noted, when people start ignoring the community spread, we'll probably see the results of that 2 weeks later when we start to see people going back into the hospitals and the ICU units. We want to avoid that. The New York governor's pause orders, Governor Cuomo's pause orders, are in effect until May 15th. If we've heard of rumors of businesses, including bars and restaurants, that wanted to open effective May 1st, you will be in violation of the pause orders. We will send Erie County Department of Health sanitarians out and we will shut you down. We don't want to do it. Follow the rules, sell takeout food. Heck, you could even sell takeout alcohol based on the rules, but do not open for in-store dining. You will only put yourself at risk to being shut down, and more importantly, you will put your vendors, or your patrons, your staff, and yourself at risk for contracting COVID-19. So please follow the pause orders through May 15th. We'll be making recommendations to the state. As noted last week, I've already made recommendation to the state that I believe, based on my conversations with local hospital officials, that we can begin once again elective surgeries in hospitals, at least on a limited basis. We have not gotten word back as to whether that would be approved yet, but I am in touch with the governor's office, and I know they're looking at that. I think they want a little bit more data before we officially prove it, but as we showed you with the one slide, which showed 2 weeks worth of data, we've been pretty stable here lately, and that's a good sign. We hope to stay that way, or at least go better, more importantly, going down on that curve. With that, we'll open up the phone line to questions to our friends from media, and we will start at the top. Do I have anybody here from the AP? Is there anybody here from Buffalo Business First? Oops. How about the Buffalo News? I know we have two from the Buffalo News.
Yes, Mark, I'm here. I had a question about essential workers at the county level. Are you increasing the number of folks who are considered essential workers in county government? It's my understanding that you are bringing back inspectors with the Division of Weights and Measures, and that they might be levying fines against businesses who are not in compliance with pricing.
Most of the individuals who are non-essential have still technically stayed non-essential in our home. We are increasing staff with regards to the Bureau of Weights and Measures, which is now in, of course, the Office of Public Advocacy under the Consumer Protection Division, or Office of Consumer Protection. We have had numerous reports of potential what we considered fraudulent aspects. Now, I don't know if it's fraudulent or for whatever reason, but we have brought back some members from the Division of Weights and Measures so they can go out there and do a true calculation as to whether or not are the parties that are out there, and it's not just gas stations, but others, are not violating the law, trying to take advantage of a situation where they think, maybe I could change the scale and make it seem like it's giving a pound of meat to someone when in fact it's giving 0.8% of a pound. So we want to make certain that people are following the rules. These are essential personnel to ensure that in this time of crisis that the scammers are not out there taking advantage of the public.
Okay, so this doesn't have anything to do with price gouging?
Price gouging, we've basically been turning over items to the, not the U.S., the New York State Attorney General's office. So if we've been getting calls with regards to price gouging, we turn those over to the New York State Attorney General's office, which actually has the enforcement power.
Okay, thanks.
Hey, Mark, this is Aaron. Can I ask you a quick question about, you mentioned the elective surgeries, and can you just share a little bit more on what you sent to the state, when you did that, and what their feedback was?
Well, it was provided to the state last week based on the most recent hospitalization data we had for pretty much 2 to 3 weeks, which, as we've shown, is we've seen some days in which we've had increases, we've had some days in which we've had decreases, but as an overall line, we've stayed fairly stable. So that was provided to them last week. They're analyzing it. I don't know if they're going to make a determination to open up elective surgeries or not. It has been provided to the governor's staff. I know it was shared with the New York State Department of Health. In the end, it is the governor who's making determinations on whether or not elective surgeries are being allowed, or I should say the governor's office. And I'm hopeful that they will take our recommendation to heart and at least allow some elective surgeries to commence back in our region. It's my understanding that elective surgeries can be held in Niagara County, and they can be held in hospitals in Chautauqua County. So it makes really no sense for them to be doing elective surgeries, but the hospitals here in Erie County to not, if we can handle it, and we can. Based on the number of beds that are available, we believe that they can handle it. And also, if by chance there is a rapid growth of cases, you can always just say they're stopped, and any further elective surgeries are now canceled or postponed. I've talked to the hospital executives, Jody LeMayo at Kaleida, Mark Sullivan at Catholic Health, and Tom Petroci at ECMC, and they do believe that they would be able to handle some elective surgeries again. Not all, but certainly some. Okay, next question then to WBEN, Mike Baggerman.
Hey, Mark. Right before you began your press conference today, Niagara County said that they were receiving testing supplies from Erie County. Is Erie County in a good enough position to be helping neighboring counties, not just Niagara, but you look at Cattaraugus, Chautauqua, Orleans, etc.?
Well, we have more testing supplies than we've had in the past, but I'll turn this over to Dr. Burstein to answer.
Thank you. So Niagara County did reach out to us with a great need for testing collection kits, and we did have some available to spare, so we were happy to share with our neighboring counties. So, I mean, we haven't been, routinely, providing to other counties because we have to make sure that we have enough supplies for Erie County, but we were really happy that we could help Niagara County at that time.
Can you continue doing this for the near foreseeable future?
If Niagara County asks us, and we have supplies that we can share with them, we would be happy to do that.
I think the thing to remember is Erie County is the center of Western New York, and we work with our partners on many different things, just like the opiate epidemic. We're not just doing it on our own. We're working with our partners in the other 7 counties. And we want to help Niagara County, which outside of Erie has the number 1, or I guess it would be number 2 cases in Western New York with regards to all positives and deaths. They have an urban center in Niagara Falls. We want to help them try to avoid any further outbreaks. So if we have the ability to do it, we will assist our fellow counties. If we can't, we just won't, because if we're unable to. But right now we're able to, so we're glad we're able to do that. Mike Desmond from WBFO.
Yeah, the people in Niagara region across the river have said they've been seeing some infection problems inside people who are quarantined, inside families and so forth. Are you seeing any of that here in Erie County?
I'll turn that one over to the doctor.
We know that people who are close contacts, especially people that live with individuals who are COVID-19 positive are at very high risk of becoming positive. That's why we put those individuals into quarantine, because we know that there is a high likelihood that either if they're positive then or they could become positive. And so I wouldn't be surprised. We haven't really looked at our data at that level to see if the people who we find are positive are and live with those who were index cases. However, we do encourage everybody who is in close contact with a known COVID positive case, and we call every single close contact to advise them to remain in quarantine and advise them, what that means and what they need to do to be released from quarantine. So you're right, though, that is a population at very high risk, and that's why they are in quarantine at that time.
Okay.
Okay, Spectrum News, Aaron Time.
Hi, Mark. Just a question about the antibody testing. Is the county planning on, when we start ramping up testing, putting numbers out for that, like you do for the positive cases?
We would eventually, yes, put out the numbers associated with antibody tests that are performed in Erie County. We've started to receive some numbers, but we don't feel comfortable putting it out right now because it's such a small amount and is not really representative of Erie County. We don't know where it's coming from. This is from not Erie County's tests, but from those that have been received, we believe, through Quest labs that go to the state system. I'll turn it a little bit more over to the doctor, but we're not at a point right now where we would be able to put that out. But yes, it is our intention to identify how many individuals have received the antibody test and what the percentage of positive versus negative is. Doctor?
Yeah, thank you. I mean, we believe in the next week or so, we will be seeing an increase of availability of antibody testing. As the county executive mentioned, right now, Quest is a primary laboratory that's offering antibody testing, and we're not really sure. And there've been some small numbers trickling in of antibody test results. We're not really sure who those people are, if they're reflected of the rest of the community. I mean, it might be just healthcare workers, so we're not really sure. But we imagine within probably in the next week, it'll open up with antibody testing from our lab and from hospital labs, as well as we've heard that urgent care centers will be offering this now if they may not already be offering it. So there will be much more antibody testing available, and we will, of course, share those data when we have more widespread testing done, and we can have a little bit of more confidence that this is more reflective of the general population, just not, rather than sporadic trickling in of test results.
Thank you, Doctor. Next is WKBW. Is there anybody on the line from Channel 7? If not, WIVB-TV, Channel 4, Sarah Minkowitz.
Hey, Mark, thanks for taking my question. You mentioned infection rates are higher than nearby cities such as Cleveland and Pittsburgh. Could the reason why we have more cases than those cities have anything to do with the amount of testing we're doing here in Erie County?
Well, actually, the Allegheny County in Pennsylvania, I believe, has performed more tests than we have. It's not a testing issue as much as I think it is just a whole bunch of variables, including the amount of travel that we had back and forth early on between New York City and this region. There's always a lot of travel between Buffalo and New York City on a daily basis. Some of those states started shutting down a little sooner than we did. So there's all kinds of variables that go into place. Our proximity to a foreign border into Canada, including travel between the U.S. and Toronto of a lot of folks, and we're seeing some numbers in Toronto that we know is an international city. So it's tough to say, but we do know that as a percentage of our population, we're higher, and we're just higher in the gross numbers. They have 300,000 more people in each of those two counties, so they should be higher if you would think that we were on par with them. And right now we have more cases and more deaths than both those counties in just a straight gross number, and then on a per capita basis based on our population. Channel 2, WGRZ, Emily Watkins.
This is Steve Brown.
That doesn't sound like Emily.
The projections that we were talking about from the modeling data a couple of weeks back. Yes. My question is, based on what you're reading now lately with hospitalization, ICU rates, what have you, does that modeling still hold in your opinion, that we're looking at a best case scenario of a peak sometime in late May, or do the numbers coming in lately make you think perhaps that the peak could be at another point?
I think there's actually going to be some adjustments to the modeling. Dr. Burstein could talk more about that because she's been in direct contact with the individual at UB, Dr. Winkelstein, who's been putting this together with his team. I'm hopeful that the modeling will be adjusted so that we're at our peak now, but I can't say that that's necessarily the case. But Dr. Burstein, do you have more information?
Yeah, thank you. So I know that Dr. Winkelstein is rerunning his model every week, looking at the new hospitalization data and new mortality data to revise what those curves look like. And so as our hospital data looks like it's flattening out and reaching a plateau, I imagine that will be reflective of the modeling data that Dr. Winkelstein has to present, and we imagine that the curves will look different with these new data. So we're looking forward to seeing an update sometime this week from Dr. Winkelstein. But we do feel optimistic that the curve is changing, and it will look in a more favorable light in terms of what we can expect and what the hospitals can expect in terms of being able to meet the community's needs with their hospital capacity.
Very good. Thank you.
Okay, we'll go back to the top. I don't think we have anybody from the AP or Business First. Is there anyone else I have not called upon? If not, we'll go back to the Buffalo News, Sandra Tan and Aaron Bessiker.
Yes, thanks. In light of the shortfall that Erie County is expecting with its budget, have you given any further thought about the need for furloughs or any other cutbacks to county employees on the payroll?
We're looking at all aspects of it. I'm also in touch with Senator Schumer's office and talked to the senator a couple weeks ago. I'm going to be hopefully talking to him again later this week, requesting federal assistance for the loss of revenues for local governments, not just Erie County, but other local governments as well. We'll be looking at all measures, including potential mid-year budget adjustments as necessary. I do not want to have to lay anyone off, but I can't pay for people with money I don't have. So we're considering it. Everything's on the table. I would love to be able to say that we'll be back to business as usual in short order, but I know that's not the case. And if we do not have the revenue to pay for the services that are to be provided, or as has been stated by the governor's office, they're expecting a large cut to local government funding, including the assistance and aid we received, we have to respond. I just can't pay for positions that I don't have money to pay for.
So you don't know when you would need to make this decision?
Well, we're constantly reviewing it. Our budget office is giving recommendations, and we're hopeful that we receive another round of stimulus funding, but I'm also going under a worst case scenario, which is it doesn't happen. So we're putting together varying levels of plans. I'm hopeful I wouldn't have to implement them during May, but we might.
Thanks.
Aaron, any other questions?
Mark, could I just follow up on the elective surgeries question forward? What exactly is the state still waiting to get from you? Is it just more data? They just want to give it a little more time before they make a decision? Do you know what they're looking for?
I think they're just looking for more data to show that we have, we're either at our peak or going down. If they feel that we're continuing to go up, I know they won't do it. We've been pretty flat, as we showed in the little screen. If you could go back to Derek and find it and then put it on the screen, the hospitalization data, particularly the last 2 weeks. I'm gonna go back a few more, couple more, two more. There we go. Well, this goes back all the way to March 27th, and you can see we've had that one big jump up, I think, which was on the 18th or 19th of April, but otherwise we've been fairly static with regards to the overall hospitalizations as well as our ICUs and, importantly, ICU intubations. Now, if we open right back up the business is normal, I guarantee you in 2 weeks you'd see those numbers shoot straight up. So we have to find a way of trying to balance the reopening with keeping these hospitalization numbers where they are. If the hospitalization numbers shoot up, there's no way we can do elective surgeries. So we're looking at this data here. This is being shared with the state. So we know that we're on the curve somewhere, but the curve is flattened out over the last 2 to 3 weeks. Is that a good sign? Yes. We're not increasing. We are still seeing deaths, though, and we are still seeing new hospitalizations. So if you could go up to the admissions and discharges slide, Derek, you will see the next slide, I think. Oop, there we go. You'll see, we want to see as a continual trend, the red bar being bigger than the blue bar. The blue bar is admissions and conversions. In other words, people who were in the hospital were admitted for whatever reason. Usually they were admitted because they had symptoms of COVID-19 but hadn't been proven to have COVID-19 yet. We want the blue bar to be less than the red bar. That means our admissions will be less than the discharges, and over the period, a longer period, our cases will be going down. If we get like we were about a week or so ago, in which there were more blue bars than red bars, or longer blue bars than red bars, then that's not a good sign. That means that our caseload's still going up. So we're monitoring that. The state's monitoring it. I kind of like where we are compared to where we were 3-4 weeks ago, in which we were on that upward trend, but we haven't really shown a big downward trend yet. We just sort of kept stable. So the state is just, I think, looking for a little bit more data. Aaron from Spectrum.
So parts of Pennsylvania are talking about potentially opening as soon as the end of next week. What do you have to say to people who might consider driving down there to go to businesses as they open while we're still waiting for our reopening phases to start up here?
I actually talked to my counterpart in Erie County, Pennsylvania today, Kathy Dahlkemper. There's 3 Erie counties. There's Erie County, New York, there's Erie County, PA, and there's Erie County, Ohio. They have much less cases. I think she just said they actually are just had their first death over the weekend. They actually shut down much sooner. She has a shelter in place for residents down there, as well as the governor's office. It's much stronger than what we have here. So they shut down a lot sooner. If people are thinking about driving down, what County Executive Dahlkemper told me is she doesn't expect the bars and restaurants to be open. She doesn't expect retail to be open. There may be some businesses that reopen, and what I was under, she was under the impression that they weren't going to open in Erie, PA until sometime around May 8th at the earliest. I would just recommend to folks that you got to remember you're going into an area where you haven't been. You could be bringing COVID-19 to them. You may have it and not know it, or you could get it from down there, so be very careful. I think we all want to understand that when we do these reopenings, we're not bringing people from other parts of the state or other parts of the country, so to speak, into communities where they haven't been. That could be bad for them. It could be bad for us. So I would just recommend that people continue to use some smart due diligence in their analyzation of what they're going to do. Refrain from going to the stores as often as you can. If you can do one travel to the store a week, that's fine, rather than going over 3 or 4 days in a row. And we would not necessarily think it's in the best interest of people to just drive down to Pennsylvania because they may be open. They've closed a lot more than we've closed. Their marinas are closed. The marinas technically are open here now. Their golf courses are closed. They've closed a lot more things, so they may reopen things that technically we've already opened. So I think it would be, before you take a travel down to Pennsylvania, whether it's Bradford or Erie, you might want to think about whether it's safe to do that, and more importantly, is the thing that you're going for even going to be open? Because if it's retail based, I don't think it's going to be opened. No one from WKBW still? If not, WIVB?
Hi, I guess once, I know we're still, weeks away from this, but once businesses do start opening back up, if the county experiences, an increase in infections, will the county, rethink or close places again, or how, will that process work if it's not still too early for that?
Well, it is still a little too early for that, but everything will be on the table at that point. We're not going to have gone through this period here, the shutdown of roughly 45 days, to then reopen and have the numbers just blow through the roof. Everything will be on the table, but we'll consider it then.
And we will expect to see, some increases in disease, incidents and hospitalizations, and we'll just have to decide, what we're willing to tolerate and decide when we need to close down again to bring those numbers down again. But we should expect to see some type of increase when we, lessen up the social distancing. That's why we're hunkering down right now to keep the numbers as low as we can.
Thank you, Dr. Burstein. A final question to Channel 2. Anybody still there?
Yeah, quick question. Based on the data that you're seeing now, are you more optimistic, less optimistic, haven't decided yet that the peak could be here or that we could be on the backside of this?
Well, I think you have to remember that there is the CDC, Dr. Fauci, and others are talking about multiple waves. We are still in the first wave. And we're talking about an 18-month period before possibly having a vaccine. So I'm looking at this as the beginning. We're still in the beginning. Are we in the middle of the beginning? I don't know. I'd like to think we're in the middle of the beginning, but this is not going away. It brings up a good point, Steve, because a lot of people are sort of like, hey, reopen, the virus is disappearing. The virus is not disappearing. We've done a very good job of stopping the spread of the virus, but the virus is not disappearing. The virus is out there, and we have to understand that this is going to be months and months of dealing with this in some fashion or not. Dr. Burstein, would you like to add on to that?
Yeah, thank you. Yeah, I mean, that's why we are instituting this the social distancing because this COVID-19 will be with us for a very long time until it is a vaccine preventable disease. And even then, we still see vaccine preventable diseases pop up once in a while, but we're going to have to figure out how to live with COVID-19 in our community for months. And so, again, people want to go back to the way it used to be. It'll never be like that, and we won't even be able to approach that type of living situation until we do have a vaccine with us.
Kind of reminds me a little of the old Churchillian statement with regards to what they dealt with at the beginning of World War II, and they were talking about, is this the beginning of the end, where we are? And of course, he was more introspective and said this is really more the end of the beginning, maybe. And I don't know if we're even at the end of the beginning yet, or if we're somewhere in the middle of the beginning. But we're looking at this not as just on a day-by-day basis, but also the calculation of what we can expect in the future. If we were to reopen Erie County back to what it was, we would see huge jumps, incredible spikes in hospitalization and deaths. Even if we slowly reopen Erie County, as the doctor just noted, we would anticipate seeing increases in hospitalizations and deaths. Is it enough that we can handle them? That's the question. We don't want to open up everything and then swamp our hospitals and have them incapable of handling what's going on in the community. So I think it's important that we look at this as long-term. People that want to be short-term saying, hey, everything's fine, let's get back to normal, it is not fine. And we'll not be getting back to normal anytime in the near future. I wish we were. I really wish we were. I'd much rather not have these daily press conferences. I'd rather be talking about growing our economy, the projects we're working at Bethlehem Steel site, and now the new one that we're going to be doing at the Agricultural Industrial Park in Evans. Projects that we have to strengthen seniors in their homes or children through the Operation Primetime program. We have to put all that stuff on the back burner right now because we're going to be dealing with this for quite some time.
And can I say, if I could add, please, that remember that we don't know if people who have been infected with COVID-19 once can get reinfected or not. There are some data from other countries that suggest that people are able to get reinfected. So just we really don't know what level of immune protection will people receive after being infected with COVID-19. So that's why that even when people think like, oh, I want to get infected now, then I don't have to worry about it. And or hopefully will be enough people in our community that have been exposed that will reach herd immunity. We can't say that at this point. So that's why it's really important. Our only known tool that is effective is what we've been doing with social distancing and staying away from people that are ill and our environmental cleaning. So that's what we know that works, and that's what we have to stick with until we get a vaccine on the market that we can dispense rapidly.
Thank you, Doctor. I think it's appropriate to stop there. We want to thank everyone for participating once again in this media live briefing, which has been provided live also on the county's YouTube page as well as my county executive page. We remind everybody to use your hand sanitizers. I'm going to do it right now. Use my hand sanitizer, and then as soon as I walk out of here, or as soon as I get up from this laptop that's in front of me and the microphone, I'm going to put my mask on right now, because when we're in the Rath building, we wear our masks. So make certain you wear your mask when you're out in public, especially if you're going into stores. I've heard stories of individuals who are like, oh, I'm going to be macho, I don't need a mask. Well, I don't care how macho you are. If you were Randy Macho Man Savage, I'd be recommending you to wear your mask because that's the only way to truly protect yourself. Your machismo level is not going to protect yourself. Your mask can protect yourself and protect others. So with that, be safe, everyone. Be well. Wear your masks. Thank you.